Welcome back. Now I'm going to shift gears and talk about the blood pressure control. So ignore blood flow control, that's going to be on a previous video that's already up on my channel. But now we're going to talk about blood pressure control. So for here, we need to know the difference between acute control and chronic control. So for the acute control, this is going to be mostly controlled by your nervous system. And then on your chronic control, this is going to be regulated by your kidneys and that renal body system. So for starters, we need to know what arterial pressure even is and how we calculate it. So arterial pressure is going to be your total peripheral resistance times your cardiac output. That's going to give you your arterial pressure. So for acute control, this is when your nervous system is going to regulate what's going on. But don't be confused with the amount of control that your nervous system actually has on the adjustment of blood flow to the tissue. Your nervous system is just going to be able to affect the redistribution of that blood to different areas of the body. When we want to control the blood flow to the tissue itself, that's when we're going to have that acute regulation of blood flow. That's different, and that acute regulation of blood flow is then going to also help us with the acute regulation of blood pressure. But your nervous system is not going to do that. Your nervous system is just going to be able to redistribute the blood into different areas of your body. However, we also need to know that our nervous system is going to be able to increase the activity of our heart and control the rapid control of arterial pressure. Most likely this is going to be your sympathetic system. So let's get into what the sympathetic system versus the parasympathetic system do. So your parasympathetic system is going to be able to control your vascular tone and your heart function. It does both. So it's going to be able to increase your heart rate and also increase your force of contraction. However, your parasympathetic system is only going to be able to work on function, not that vascular tone. So it is not going to have any effect on the amount of contraction, the strength of contraction, none of that. It's only going to be able to decrease this heart rate. That's the difference between the amount of control the sympathetic and the parasympathetic do. Sympathetic can do both, parasympathetic can only do that function, which is decrease heart rate. And then over here, we can see that the sympathetic nervous system is actually going to have a large amount of vasoconstricting fibers and a few amount of vasodilator fibers. That makes sense because when you're having a sympathetic control, you're expecting that to constrict all of your blood vessels. Whereas if you have a parasympathetic control, you're expecting that to relax all of your blood vessels, therefore vasodilating all of those blood vessels. So that makes sense. And then where does this occur? Where does your sympathetic and parasympathetic affect anything? So that's going to be in this vasomotor center. There's going to be a sensory area that's going to affect both, and that's going to be innervated with your glossopharyngeal and vagus nerve. And then there's going to be a vasoconstricting area, which is mostly sympathetic, and then your vasodilation area, mostly parasympathetic. What sends the signals to this area in general? So we know what is being controlled, where it's being controlled, so now what sends the signal there? So we're going to have two different things. We're going to have these baroreceptors and we're going to have chemoreceptors. So baroreceptors are going to actually be initiated by the stretch of the receptor itself. So these are going to be located on a peripheral or a location outside of the brain, both of these, and then we'll get into factors that are located inside of the brain. But what the baroreceptors are going to do, they're going to regulate this high arterial pressure by decreasing both your peripheral pressure and your cardiac output. So it's going to be able to initiate the vasoconstriction and, inhibit your vasoconstriction and initiate your parasympathetic. If we have high peripheral resistance, we can assume that we have that vasoconstriction. Vasoconstricting is going to cause that high pressure. So if we inhibit the vasoconstriction and we excite parasympathetic, we're going to relax our blood vasodilate and therefore decrease our arterial pressure, if that makes sense. So that's what our baroreceptors are going to do. There are two different locations. There's some locations on your carotid, and those carotid receptors are going to be innervated by this glossopharyngeal nerve. And then we're going to have some on that aortic arch, and that's going to be innervated by your vagus nerve. And then what we do want to know is that these are not useful for long-term regulation. I'll go over long-term regulation in a second, but the reason these are not useful is because they actually auto-reset. It's called baroreceptor resetting, and they reset themselves after 1 to 2 days. So you can imagine if they keep resetting themselves, they're never going to be able to fully continue to regulate your arterial pressure and the changes that are coming with it. However, on the other hand, we're also going to have these chemoreceptors. The chemoreceptors are very similar to baroreceptors. They work in very similar fashions. The only difference is that baroreceptors, like I mentioned, are initiated or activated by the stretch of the receptor, but chemoreceptors are activated because they're sensitive to the detection of oxygen, carbon dioxide, or even hydrogen ions in your blood. That's when they come into play. And then they are only activated when you have a arterial pressure of under 80 millimeters per mercury. So this is only very helpful when you have very low blood pressure. And then the way this is going to send the signals to our VMC or vasomotor center is the vagus nerve is going to be able to send that up, just like these aortic arch baroreceptors. And then this was all stuff that's going on outside of the brain. Some things that can actually regulate the arterial pressure from the inside of your brain is these two ideas of our central nervous system ischemia and then Cushing response. So central nervous system ischemia is basically when you have a low oxygen supply in your brain. That's what ischemia means. And then, well, technically. And then that is going to happen when you have a low pressure. So you have actually a lower pressure of 60 millimeters per mercury. Over here, our chemoreceptors were working at 80. So this is very dangerous, and if we don't catch this on time, about 90% of your animal is going to be dead. And then there's not really much you can do. That's what he said in the lecture. But when we have this low 60 arterial pressure, that's going to cause you to not get enough circulation up to your brain and cause that low oxygen in your brain, and that's what's going to cause this ischemia. That low oxygen in your brain is then going to cause a vasodilation because we're losing this powerful vasoconstrictor. And once we get that vasodilation, we're going to be able to get increased blood flow and fix this issue if we catch it on time. So we would then do some things with our previous lecture that we learned about with vasodilators. However, another response that we can have is this Cushing response. So the Cushing response is actually also because of this high arterial pressure. When we have this high arterial pressure, we're going to have the compression of the overall cerebrospinal fluid and the brain itself. We're going to have such high pressure in that cerebrospinal fluid that we're going to start to compress the brain. And when we compress the brain, we compress these vessels and other things, which are also going to cause this central nervous system ischemia, low oxygen. We see the cycle, and then we need some vasodilators to get that situated and recontrolled. So those are some things that happen inside of the brain itself. Now we're going to go on to this chronic regulation of blood pressure. So this is in the kidneys, in that renal blood body system. So what your kidneys are going to do is that we are going to try to excrete when we have extracellular fluid. By extracellular fluid, imagine that the dog drank too much water and now we're trying to excrete that extra water. Okay, so one thing we need to know before we get into it is that kidneys will not excrete an adequate amount of salt and water unless our arterial pressure is high. So our body is going to try to get that arterial pressure to increase so that our kidneys can then do their function and excrete the extra salt and water that we have in our body. So going on with that system, we're going to see here that as I was saying, we're going to have a excretion of water or salt. And there's two terms that he wants us to know. So we're going to have the pressure diuresis, which is the excretion of water, and then we're going to have pressure natriuresis, which is the excretion of salt. Those are two terms that we should be aware of. And then the analysis requires that we know our salt and water intake and that we also know our urinary output. So we can make this urinary curve, this urinary graph here, to see how much we're excreting and how much in correlation to how much we're being input into our body. And then one thing we should keep aware of is that in order for us to increase our arterial pressure, we would have to either, one, shift this urinary output to the right, which is increasing our pressure, or we would have to increase how much water and salt we input into our body, okay? Another thing to keep in mind, so many things to keep in mind, but it's important to know that salt is actually harder to excrete than water. So salt is going to cause a faster or more intense increase in arterial pressure than water. Not because salt or water, one or the other, is more better at hydrating or anything, or it's just because salt is harder to excrete. So that's going to increase the arterial pressure more than water. And then another thing that can regulate this with our renal body system is to understand this renin-angiotensin and aldosterone system, that RAS system. So we need to know that angiotensin is going to then convert into angiotensin 1, then convert into angiotensin 2, and lastly convert into aldosterone. And then this angiotensin 2 is actually going to also turn into two different things, which is this ACT1 and ACT2. ACT1 is going to be a vasoconstrictor, and ACT2 is going to be a vasodilator. So this we can kind of use to our advantage if we ever need to retain or excrete water, or salt. So right now we're going to use AT2 to our advantage. So right now what AT2 is going to do is going to cause this retention of salt and water. This retention of salt and water is going to increase our arterial pressure. And remember I said that the kidney is not going to excrete nothing adequately if it doesn't increase this pressure. So this is good. We need this retention of water to increase our pressure. Once we have this increase of pressure, then our kidneys can excrete that excess salt and water. And then this is going to have a direct and indirect effect. So we can directly have this retention in our kidneys, or we can have an indirect effect with these adrenal glands that are also going to cause this retention. And as I said, it's going to increase pressure, which is going to help us excrete that excess fluid. And then right here, we also want to know that our aldosterone is also going to have some retention factors, which is good. Our last thing that I'm going to mention, he mentioned it in class. I'm not sure how important it's going to be, but I just want to mention it just in case. Whenever we are talking about medications, if we want to stop a angiotensin converting enzyme, we're going to use a medication that ends with pril. And then if we want to stop this ANT1, this vasoconstrictor, we're going to use Arcan, something that ends with Arcan. And that's pretty much it for this lecture on blood pressure control. Thank you for watching.